Welcome back to Fluvoxamine Frontiers, battling COVID 19, where we are uncovering fluvoxamine's unique journey in the pandemic. I am your host, Dr. Soma Rohatgi, joined by our guest, Saakshi Sharma. Today, we are exploring how grassroots efforts by clinicians and communities have pushed fluvoxamine forward as a COVID 19 treatment, even without widespread approval. Picture fluvoxamine's adoption as a community garden where neighbors, doctors, patients, advocates plant seeds of hope, growing solutions despite limited resources. How have these grassroots efforts shaped fluvoxamine's use? Let's find out. Sakshi, let's start with the movement. How have grassroots efforts by clinicians and communities promoted fluvoxamine's use for COVID 19?
Soma, grassroots momentum has been a game changer totally. In places like India, clinicians in small clinics, inspired by the 2020 Stop COVID trial, began prescribing fluvoxamine off-label for high-risk outpatients, sharing success stories through medical networks. In Brazil, community health workers in 2022 organized webinars to educate rural doctors, leading to wider use in the undeserved areas. Patient advocacy groups, especially online, have also spread awareness, with forums sharing stories of recovery, like 2023 South African initiative that lobbied for fluvoxamine in local clinics. These efforts bypass slow regulatory systems, bringing treatment directly to those in need.
That's very inspiring. Communities planting hope. What real world evidence supports this community driven initiative for fluvoxamine?
Real world evidence is the backbone of this movement. A 2022 observational study in India tracked 500 outpatients using fluvoxamine, finding a 40% reduction in severe symptoms compared to standard care. In South Africa, a 2023 clinic-based study reported that fluvoxamine users had shorter recovery times, with data shared via open access platforms to encourage adoption. These studies, driven by local clinicians, provide practical insights that complement controlled trials like Stop COVID. Community health records, like those from Brazilian clinics in 2022, also show fewer hospital admissions among fluvoxamine users, fueling grassroots confidence in its efficacy.
Thank you, Sakshi. That's powerful evidence from the ground up. Now, what are the risks of grassroots adoption without formal guidelines and how can they be mitigated?
Grassroots adoption is a double-edged sword. Without formal guidelines, there's a risk of inconsistent dosing. Some clinicians in a 2023 Indian study used higher than needed doses, increasing side effects like nausea. Mitigation involves clinician training, as done in South African workshops in 2023, and clear interim protocols from local health authorities, like India's 2022 guidelines. These steps ensure the garden grows safely and effectively.
A garden that needs careful tending to thrive. Fluvoxamine is a seed planted by community hands, growing hope in the fight against COVID 19 when nurtured with care. Grassroots efforts backed by real world evidence are cultivating solutions where systems lag behind. Thank you, Sakshi, for showcasing this community spirit. Listeners, keep growing with us on Fluvoxamine Frontiers.